Hi guys, my name is Damo. I'm from MYP 98. I'm pretty sure most of you guys know me. Today, I'm not going to do a cooking show, but my dad, who's a doctor, is going to give a talk about breast cancer. So guys, sit back, relax, and enjoy the show. Bye!
But luck will leave you 'cause it is a faithless friend. And in the end, when life has got you down,
Do you know breast
you've got
cancer is the most
something
common form of
to
cancer
grab
affecting
hold
Malaysian women of all races? Breast cancer doesn't
to. So hold
discriminate whether you're Malay,
on.
Indian, or Chinese. Breast cancer was the commonest overall cancer as well as the commonest cancer
Hold
in women
on.
amongst all races from the age of 20 years in Malaysia for
Tonight,
2003 to
we are
2005.
stronger here together.
Breast cancer is the
Cause
most
we
common in
can
the
never
Chinese,
be
followed by
alone.
Indians and then Malays.
Unto me,
Breast cancer formed
but you won't
31%
let me go.
of newly diagnosed cancer cases in women in 2003 to 2005.
There's a thousand ways for things to fall apart.
Although breast cancer in women
But
is a
too
common
much
form of
longer.
cancer, male
We
breast
will
cancer
never
does occur
walk
and accounts for about 1% of all cancer
and
deaths in
maybe
men.
all the plans we made
Research has
got
yielded much
forgot.
information about the causes
But
of
I
breast
have
cancer,
no
and
doubt,
it is now believed
even
that
though it's
genetic
hard to
and
see.
or hormonal factors are
I
the
believe
primary
in
risk
us,
factors
I
for
believe in
breast
you
cancer.
and me. So hold
About 1
on
in 19
to
women
me
in this country
tight.
are at risk compared to
Hold
1 in 8 in
on,
Europe and
I
the
promise
United
you'll be
States. Breast
alright.
cancer occurs when the cells in the
'Cause
lobules,
it's
the
you
milk
and
producing
me,
glands, or the ducts
and baby,
become
all you
abnormal
got
and
is
divide
love.
uncontrollably.
So hold
These
on to
abnormal
me,
cells begin to
hold
invade
on to
the
me
surrounding breast tissue
tight.
and may eventually spread via blood vessels and lymphatic channels
Some
to the
may
lymph nodes,
say that
lungs,
we
bones,
have
brain,
failed.
and liver.
Take a look at all we've
What are the
got.
investigations that a doctor will do? When a patient
With
detects
this
a lump
kind of
in the
love
breast,
and what we've
a
got
specialist's
going
opinion should be sought to confirm if the lump is cancerous or not. The doctor will perform a thorough physical examination before requesting for a mammography and ultrasound scan of the breast. A tissue sample in the form of a needle suction or biopsy may be obtained. Upon confirmation of the cancer, the patient will be staged with x-rays or scans of the lungs and liver. A bone or brain scan may be ordered to evaluate any spread to the bones or the brain. What is a mammogram? A mammogram is an X-ray picture of tissues inside the breast. Mammograms can often show a breast lump before it can be felt. They also can show a cluster of tiny specks of calcium. These specks are called microcalcifications. Lumps or specks can be from cancer, precancerous cells, or other conditions. Further tests are needed to find out if abnormal cells are present. Before there are symptoms, women should get regular screening mammograms to detect breast cancer early. Women in their 40s and older should have mammograms every 1 or 2 years. What is an ultrasound?
Didn't they
If
always
an
say
abnormal area is found during a clinical breast exam or with a mammogram, the doctor may order, among other tests, an ultrasound. A woman with a lump or other
but
breast
luck will
change
leave you
may have an
'cause
ultrasound
it
test.
is a
An
faithless
ultrasound
friend.
device sends out sound
And in
waves
the
that
end,
people can't hear.
when
The
life
sound waves
has got you
bounce off
down,
breast tissues. A computer uses the
you've got
echoes to
someone
create a
else who
picture.
can wrap your
This picture may
arms
show whether a
around.
lump is solid,
So
filled with
hold
fluid called a cyst,
on
or a mixture of
to
both.
me
Cysts usually are not cancer, but a solid lump may be a cancer.
to me tonight. We are stronger here together
Biopsy.
than we
A
could
biopsy is the removal of tissue to look for cancer cells.
unto
A biopsy is the only way to tell for sure if cancer is present. There are several forms of biopsy. Number one, fine needle aspiration biopsy.
There's 1,000 ways
The doctor uses a thin needle to remove cells or fluid from a breast lump.
once for
Number two, core biopsy. The doctor uses a wide needle to remove a sample of blood of breast tissue.
plans we made.
Number three, skin biopsy. If there are skin changes, the doctor may take a small sample of skin. Number four, surgical biopsy. The surgeon removes a sample of tissue. Now, what are the treatment options? Treatment can be surgery, radiotherapy, chemotherapy. Surgery can be conservative, that is, removing the lump or a segment of that breast only, or maybe in the form of a mastectomy, which is removing the whole breast. In both cases, the glands in the armpit need to be removed and checked for the presence of cancer. Radiotherapy uses high doses of radiation to kill cancer cells. It is a localized form of treatment and is mandatory after conservative surgical treatment. It is only given after a mastectomy if the breast tumor is locally extensive. Radiotherapy removes the risk of local recurrence rate. Radiotherapy is sometimes used as a palliative treatment to control bone pain, bleeding, or pressure symptoms. Chemotherapy involves the use of drugs given by injection or occasionally orally. It treats the cancer by penetrating the tissues and organs via the bloodstream. These drugs are toxic to the cancer cells, but they may also cause some side effects to the normal tissues. Advice: patients should discuss treatment options with the oncologist, the cancer specialist. While the treatment of breast cancer is standard throughout the world, the oncologist has to be carefully assess each patient and tailor-make the appropriate therapy. The oncologist will be able to advise patients on some of the latest developments in the management of breast cancer. What is the prognosis? Breast cancer is curable if detected early. Cure rates for stage 1 and stage 2 cases may be high as 80% and above. For stage 3 disease, the percentage of cure is much lower, but for stage 4 disease, the aim of treatment is palliative, that is, to control the symptoms. Conclusion: breast cancer is a potentially curable disease if detected early. Clinical or self-examination combined with screening mammography can detect the disease early. With appropriate treatment, cure rates are high. There is no alternative to cure except for standard therapy. Patients should not gamble with their lives by delaying treatment or seeking alternative therapies that are not proven.